Welcome to All Powers from Within. My name is Ishwar. I help people expand their consciousness and accomplish any goal beyond their wildest dreams, especially after enjoying an exquisite coffee and a meal like right now. So, there's been quite a few requests. In fact, I would say some kind of jibes in some way where people they just don't get around to do the breathing exercises, for like improving their lung capacity and stuff. They've tried other yogic techniques and stuff. They do get surprising benefits and improvements in their health, but they say that it's very kind of tricky for them. They are starting to doubt themselves when they do the rhythmic breathing, especially the ratio and the count of 5, whatever I explained. So you need to build up enough for you to be able to retain at least 16 seconds. You could even do, like, if you're able to retain 12 seconds, that should be good enough. And as usual, I always ask you to do any exercise, whatever, under your own guidance of your physician and your own responsibility. So you are the best judge to find out if you are able to retain 12 or 16. However, just the fact in anything that you do in life, personal development, health, finances, whatever, when you are getting into it, you pick a strategy, you're going all in, and you definitely need to course correct and also take proper note of what improvements you've already made. If you cannot see any improvements at all after a certain time, it's human nature to give up. So therefore, I would say if you've given it a try, the breathing exercise, and you are unsure right from the beginning and you do not feel any momentum, then I'm going to suggest a few other techniques which are not about breathing. However, they help you improve your lung capacity, and they help you improve, like, some of those techniques, the most advanced ones. If you persist on them, you could improve your overall health a lot, and even your life expectancy. However, there's always certain exercises which some people are restricted due to their age or condition. So again, you'll have to judge it on your own. So the first exercise I'm going to suggest is you need to pick something like one of those yoga blocks that they have, which is, you can use it as a stepper. So like you do in the aerobic classes, like, you just step on and off, on and off, like that, several times. And then besides that, this is for absolute beginners. No matter if you have restricted COPD and stuff like that, obviously while you're doing it, you shouldn't feel any suffocation or anything like that. Or if you're just feeling overwhelmed, you're about to pass out or something like that, don't get to that extreme. Always try to use everything with quite a bit of common sense and also your gut feeling in that moment. So besides the first one is the stepper, you can do, besides that, you just take a very comfortable chair. It has to be, I just want to give out this caveat right from the beginning. It has to be a chair where if you happen to fall, it's no problem. It shouldn't just drift you off somewhere else or, make you bang your head against the wall or anything like that. It has to be a very kind of easy, comfortable chair on which if you happen to fall, there should be no problem. So you try to, you can start with 30 seconds. Within 30 seconds, you should be able to get up and then sit back at least 12 times. If you're not able to do 12 times, then in any of the exercises I'm going to suggest in this video are not going to be a proper fit for you, or maybe too hazardous. Therefore, you might have to reconsider, or I would just not even bother, because if your lung capacity is so restricted, you definitely need some medication to come out of it, to be in a state where you can do the rest of the exercise. Okay? So you start 30 seconds, you get up, and you should try to like take note of it and keep pushing your capacity and get to around, in 30 seconds, if you're able to get to 22 to 25 times that you can get up, you are in great shape, okay? And after that, after having got to that, nevertheless, some people can get straight to the one I'm going to suggest, which is simply squatting. And it is incredibly efficient when you do it early in the morning on an empty stomach, just after, you may have to go to the toilet to make sure you just get it all out at your living room or wherever you're choosing to do this, or your gym. So you can start squatting, say, in the very least, I wouldn't suggest doing less than 20, okay? You need to push yourself, guys, and if you feel like 20 is being too much, then you stick to it for a couple of weeks, and after a couple of weeks, if you are comfortable, gradually you push it to 25, okay, or 22. It doesn't matter. The thing is, you need to make some progress. And if you are really like a CrossFit athlete and you are fit enough, although you want to push your lung capacity, or you do power lift and stuff like that, you could definitely learn how to squat with one leg, okay? And I was planning to make a video on how to squat with one leg, just like I made with the one about one-arm push-up. However, I noticed that way too many people got inspired and started taking action with the push-ups challenge. So, that obviously speaks for itself. That, making people get healthier, happier, have a better quality of life, becoming a better person is all what all this channel is about. So therefore, if you are into learning how to squat with just one leg, comment down below that you want to see a video as soon as possible. If not, I probably do it when I have enough time and I have room for doing that in a proper way. So you can do, so there's these, if you just start following these three things, which is using the stepper, your chair, squatting, you would see a steady increase in your lung capacity. And with especially with squatting, even the chair, if you do it regularly, and the chair, I'm going to say, especially COPD patients and people having a very restricted lung capacity, or even knee issues, it's paramount that you give at least 4 to 6 hours gap in between one session to the other. Even whether you're not pushing yourself to the limit, you just do it once, and then you give your whole system, especially your knees and your lungs, a little bit of a rest so that it can recover to get back. Not necessarily having stiffness. And besides these, again, this last one is, if you want to go for it, then I wouldn't stop it as long as you're doing it with proper medication and doctor's guidance and approval. However, I would suggest this is mainly for people who are athletic constitution and they're able to pull it off, just like one-arm push-up and other exercises. You want to start, and this is even more practical because you don't need, sometimes you just want to go out for a run or you want to have a treadmill, but you don't have the means to get there, or you just don't have, maybe the place where you live is too polluted, or you don't have a treadmill, or you don't have a gym whatsoever. So this is about just standing in the same place. You could do it in a corner of a kitchen. This doesn't require anything at all, just like with push-ups. These are very, very pragmatic exercises and hitherto beneficial, I would say. All you need to do is you stand in a corner and you start running at the same place. While you're doing it, you gradually bring your thighs up to the level of your hips, okay? And what you're going to do, at first you just start running, pulling your thighs slightly up, okay, while you're running. And you're going to be like landing always on your toes when you're doing this. And you may not notice it at that moment, but you're pushing your lung capacity a lot. And when you just stay with it and you keep improving it, when you get to a point where you feel that you're able to do this for 15 minutes without any problem at all, you place your hands slightly higher than your hips, and then try to hit your hands with your thighs while you are doing the runnings. Okay? Again, this is not for everyone. As usual, please take full responsibility for your health and well-being. And if you like the video, please like and subscribe, and talk to you soon. God bless.